get that started. Okay, got that out of the way. Well, I'm delighted to see you, and I usually do not use a slideshow in these sessions because I like to just see everybody's faces. But as I was preparing this, I was like, oh man, there's a lot of stuff. So I am going to use a slideshow just to get through it. I will save the slides as a PDF and I will email them to you afterwards. So you will have everything that I shared today. And so I want to be fully respectful of the time that you guys all got here on time. So we're going to go ahead and get started. Let me share my screen. And the format for today, by the way, is that I'm going to be talking about slowing dementia progression. And the reason I'm talking about this is because I did a lecture recently locally, a live lecture, and one of the women in the audience said, my naturopath has prescribed some supplements for my husband that will slow his dementia progression. And I'm wondering how you feel about that. And I said, well, there are no known supplements. I mean, we're going to talk today about pharmaceuticals and non-pharmaceuticals and prescription drugs like that have FDA approval versus supplements. And there are really, truly no supplements that are non-prescription that have been shown to slow down dementia progression. There are things that might make you feel better, that might reduce your anxiety and calm you so that you are less impacted by your dementia, but there is nothing that has gone through randomized trials that has come, and she just wouldn't believe me. So I thought, okay, we need to have this conversation. Let me, without further ado, go ahead and share my screen. And I'll go here and share that. And let me start my slides. All righty. Continue to share. And let me get rid of this CC thing. Alrighty, so I think you guys probably see a screen that says Zinnia and slowing dementia progression. Okay,
Yes.
cool, thank you. So, and by the way, at any point, just pause me if you want to stop and ask questions. So these are the things we're going to talk about today. Pharmaceutical therapies, traps that we should be avoiding, non-pharmaceutical therapies, lifestyle changes, and what is coming in the future. So I am not a doctor, right? I'm not a healthcare provider. I work very closely with a number of healthcare providers, and the information that I'm sharing today comes from my work working with healthcare providers, attending lectures about these topics, knowing people who are in the companies that I'm going to be talking about today. So I have a lot of firsthand knowledge, and I'm really happy to share it. So there have been dementia drugs around for a long time, and you probably know some of them like Aricept, Exelon, Razidine, and Namenda. And those, oh, we have somebody who just popped in. There we go. All right. So continuing, hi Morris, welcome. We're just getting started. So there are a number of pharmaceutical therapies, as I just said. So the first three, the Aricept, Exelon, and Razidine, are what are known as cholinesterase inhibitors. And this stuff is in our brain called cholinesterase, and it naturally breaks down. And so, and it's a chemical that's crucial for memory and learning. And so what these drugs do is they help to prevent the breakdown of this acetylcholine that's in our brain. These drugs help that stay in abundance so that it can help with memory and learning. And so what this looks like for a person who's taking it, and by the way, these are approved for Alzheimer's. They are often also used for people who have Lewy body dementia, vascular dementia. They are contraindicated for frontotemporal dementia. But the way that they affect some people, not all people, is that they just make them seem a little sharper and a little bit more present. Namenda is different. It's not a cholinesterase inhibitor. It is, I'm telling you more than you probably ever wanted to know, but there is this stuff in our brains called glutamates, and in Alzheimer's disease, those grow in abundance and they're bad. And so Namenda prevents the overproduction of glutamate. Or it slows down it gets in the way, it blocks the glutamate receptors. And so a lot of people will be um, prescribed both a cholinesterase inhibitor and Namenda. Namenda is usually prescribed later in the disease progression. The cholinesterase inhibitors are usually prescribed fairly early on. And so um, those are in use. They have been, there are studies that suggest that there is a neuroprotective element to these drugs, that not only do they job that they set out to do to help there be more acetylcholine and less glutamate, but they also seem potentially to slow down progression a bit. These are used, these drugs treat the symptoms of dementia. They do not treat the disease itself. They don't modify the disease in any way. They treat symptoms. And as I said, they've been around for a long time. And just a show of hands, are any of you familiar with these drugs? Do you have people who are on these drugs? Yeah, they're almost always prescribed. Um, and people will say, yeah, but I'm not really seeing any impact. Should we go off the drug? And I would never just stop a drug without your doctor's um, approval, I guess. Um, so now what's new is in 2023, the FDA approved the first drugs that instead of treating the symptoms of dementia, are made to treat the disease itself. And these are called monoclonal antibodies, and they are specifically intended to slow progression. The first one that came out was something called aducanumab, but there were a lot of things about it that were not really so great. So the two that are mostly used now are Leqembi and Kisunla, and I'm not even sure if I'm pronouncing that one right. I generally call them by lecanemab and donanemab, but most people that I know are prescribing Leqembi, the lecanemab, and most people I've met who are taking these drugs are taking lecanemab. The mechanisms differ in how these two drugs work, but basically what they're trying to do is get rid of amyloid plaque. Which dementia has amyloid plaque? Alzheimer's disease. There's not amyloid plaque that's associated with Lewy body dementia or vascular dementia or frontotemporal dementia. So one of the things that is so important before anybody receives one of these treatments is that we make sure that they have Alzheimer's disease. Because what these do is they reduce the amount of those amyloid plaques that are in the brain. They are most effective when the person who is taking these drugs is normally functioning pretty normally and has only small problems with day-to-day tasks, with complicated tasks as well. So early detection is key with all of these kinds of drugs. Let me go ahead and let that person into the room. Okay, so a little focus then. So we talked about two different drugs that treat the disease, not the symptoms. And the one, as I mentioned, that is sort of more prevalent is Leqembi, so that's the one I'm focusing on right now. So there are a lot of different reasons why people have MCI, mild cognitive change. Some people who have MCI start getting more sleep, start eating better, and get more exercise, and then they start behaving, their cognition returns to normal. And it's because Alzheimer's wasn't the driver of their MCI. Some people have MCI because they are already having a buildup of amyloid plaques. And so if we remember that dementia is a marathon and not a sprint, and that the stuff that produces symptoms will be in our brains for up to 20 years before we actually become symptomatic, well, at some point we're going to cross that line where we actually start behaving a little bit differently as a result of this plaque buildup. That's the MCI stage, where somebody, like, you'd barely know that there's anything wrong with them. So a difficulty in getting people onto these drugs is that most people are not diagnosed at that point. So this is especially for dementia caregivers. These drugs are less likely to be something that will be used by your loved one, because I'm assuming if you're here today, your loved one is already demonstrating some degree of dementia symptoms. But as caregivers, because of the stress of dementia caregiving, we are, of course, at risk for getting dementia ourselves. And so my message to dementia caregivers is always, let's take care of ourselves too. And that means that if we are starting to feel like we're experiencing cognitive change, we need to tell somebody about it and get checked out. There's a very good chance that it's because of stress and lack of sleep and poor eating and not enough exercise, and has nothing to do with plaques. But we want to find out so that if we'd like to take a step like this, we can. So, how does it work? With Leqembi, you must go every 2 weeks for an infusion, and the infusion takes an hour to deliver. So you are sitting in a chair or relaxed, and you've got a needle in your arm, and the medication is going into your body every 2 weeks for 18 months. In addition, you need to have MRI scans before 3 of those infusions. So 3 times during those 18 months, you also need to go through the process of having an MRI. And we'll talk about why in just a moment. So these drugs, as previously stated, remove plaque, which slows the decline in cognitive and functional abilities. And it results in, statistically, it looks like about a 20% slower rate of decline than the placebo group. So people who were taking Leqembi did see a slower rate of decline, but it's imperative that we remember that this is a treatment and not a cure. So we're not even 100% confident that amyloid plaques are the only thing that Alzheimer's is doing to our brain. So what we have found with Leqembi, for instance, is that it does reduce amyloid plaque. It also reduces tau, which is something that is part of the dementia mechanism, but that is more in the frontal lobes. And it, however, paradoxically, it also tends to reduce the brain mass more than it would have if somebody wasn't on Leqembi. So it's a real mixed bag of benefits and things that are not beneficial. So what are the downsides? The one that we hear that everybody hears about is called ARIA, which stands for amyloid-related imaging abnormalities. So these are little brain bleeds that happen inside the brain and on the surface of the brain. They happen in dementia, even if you're not taking Leqembi. Like, people get little brain bleeds. That is a thing that happens when people have dementia. However, they usually just kind of go away. And they don't result in symptoms. You don't know that you've had one of these little brain bleeds. The problem is that the brain bleed, when we're taking this drug, can get so bad and spread that it can be fatal. It's a very small percentage of times that it results in a fatality. And the reason why they do MRIs before the 5th, the 7th, and I think it was the 14th uh, infusion is because they're looking at the brain. They want to keep monitoring the brain and checking in to make sure that there's nothing going on that means that we should stop and take some course of action. More common side effects are allergic reactions like hives and swelling. And the most common reaction is something that is related to the infusion itself, where people can get like flu-like symptoms and fever, nausea, all things that are treatable. These drugs are crazy expensive. So it's $26,000 a year for the first 12 months, right? It's $26,000 just for the medication. When you add up all of the costs associated with it, it winds up being around $80,000 a year. A big thing that happened recently is that these drugs became uh, payable by Medicare. However, Medicare covers all but about 20%. So you're looking at still out-of-pocket expenses of probably around $20,000 a year if you choose to follow this course of action. What people look at is the other cost, which is the time that could be spent enjoying life, that you are instead twice a week sitting, or sorry, every 2 weeks sitting in an infusion center. I had dinner last night with a geriatrician friend, and she told me about one of her patients who lives 3 hours from the closest infusion center. Infusion centers aren't everywhere, and especially if you live in a fairly rural spot. So this woman lives 3 hours from the infusion center. You need to have a driver. You're not allowed to drive yourself home afterwards. And so her daughter drives her 3 hours there, sits with her for an hour, then drives her home again. And she does this every 2 weeks. So it's a lot. And um, so proximity to infusion sites, as I just mentioned, could be an issue. I've seen that there are websites where you can find out infusion sites near you. And what's happened is, I mean, there are infusion sites because people receive chemotherapy, for instance, at an infusion site. And so what's happening is the places that have been treating people with cancer by having them sit and get their chemotherapy are now opening up beds for people who want this kind of treatment. So the really big deal, I mean, for everybody, just has to be a good hard look at the cost benefit analysis. So if there's something like some of the people who I've spoken to who are taking this drug course say that they just feel great and they feel like it's making a huge impact. And we don't have longitudinal studies yet, right? Because it came out in 2023. So when somebody finishes at 18 months, generally the expectation is that we will see that the amyloid has gone way down in their brain. And so we stop the course of medication and then we might wait a while and then start it up again if that seems like it's indicated. So there's a lot that's still to be learned about the long-term benefits of these drugs. For many people, they feel that the out-of-pocket cost as well as the cost of time and the fairly like really pretty small benefit. So it's estimated that it will slow progression by 4 to 7 months. And so if you have something like your granddaughter's getting married in 8 months and you want to make sure that you are the top of your game for that event, you might say that alone is my driver. I'm going to do this because I want to be the best me possible for that thing that's coming up. So there are reasons to take it and there are reasons to consider not doing that. Traps to avoid. So beware of over-the-counter supplements that promise to slow progression because they're not subject to FDA regulation. They can kind of say whatever they want to say. And there is, as I said previously, nothing that is an over-the-counter thing that has been shown to have any kind of long-term effects in slowing progression of dementia. And in fact, there can be harmful side effects with medications. So if you are going to do an over-the-counter supplement, you're curious, you just want to see if it works, check with your doctor. Check, do your research, find out whether or not there is evidence that there is contraindication. And what kinds of things am I talking about? Just really quickly, things like ginkgo biloba, which is meant to kind of sharpen your brain, high doses of vitamin B. All we need really are regular doses of vitamin B. And then I've seen websites that have products that are, what we need is more vitamin A or E or C or D. But again, I've looked at the NIH studies that compare the placebo groups to the people that have taken that take these in their research, right, to produce those papers. They have looked at the results of people who before and after, and they're really finding that there's no indication that these are truly helpful. There is universal despising of Prevagen amongst the medical providers. I don't know if any of you have heard of it, but they market like crazy. And there are all kinds of lawsuits against them. There is nothing factual about the stuff that they claim you will experience if you take Prevagen. And then this is just a quote from one of the papers that I looked at. Evidence from high quality trials doesn't support the use of dietary supplements for either the prevention of cognitive decline or the treatment of dementia. So non-pharmacological solutions. So let's see, I'm really early in my disease. All of these are things that require that you be fairly early in the disease or even pre-symptomatic. Okay. And by the way, like who knows pre-symptomatically? Well, this is where things like blood tests to which are available now through the right clinics that can tell whether or not you have amyloid buildup. So you might be, if it's a 20-year thing, you might be at year 13, right? You're still 7 years away from symptoms, but now you know that you have amyloid starting to build up. You can do something about it. So non-pharmacological solutions. I chose these two companies because I know them both well. I'm friendly with with the founders. Um, I do work with them on boards and things, and I really am so impressed by what they are bringing to market. So the first one is New Days, and they were recently written up in the New York Times with glowing accolades. They also recently took a whole bunch of funding, which will only happen if there is belief that what you're doing works, belief and proof that what you're doing works. And so their product is at-home treatment where 2 times a month you have a video call with your clinician, your New Days clinician, and 4 times a week you're doing this brain training thing through an AI agent. Sunny is her name. But it is very heavily research backed, and the data proving it out is pretty phenomenal. So it's based on a vast clinical trial that has shown that these non-drug interventions delay decline and improve quality of life. And in a conversation that I had with the founder, like, well, how would they compare with Leqembi? Right? If I'm going to do something that's going to slow decline, nothing is going to cure dementia because there is no cure. But if I'm going to slow decline, would I rather go once a month or twice a month and have infusions where there is this downside of potentially getting ARIA, or something like this? Like, what would make me do this instead? And he said that the results from their trials match or exceed the results from pharma solutions. And so that's interesting. I would definitely consider this strongly before I would move towards medication. Yeah, so regaining abilities, improving cognitive performance, delaying the progression of symptoms, which is what we're talking about today. And so this is just a little bit about, I asked them to give me some slides. And so this is what they gave me. $59 fee to schedule a wellness review. And then there is their contact information. And again, I'm going to be sending you these slides. The other program that I'm really excited about is called Moneta Health. And so a personalized, it's another idea that you're doing brain work that actually slows down progression of the disease. Theirs is quite different though. In their case, it's telephone based. So you're doing phone calls with a speech language pathologist. This is not an AI agent. Now, their hope is to ultimately have there be an AI agent, but for now it's done with a live speech language pathologist who has a very prescribed conversation that she has with you. She asks you questions, she has you solve problems, and their results have been amazing. They say that 90% of patients maintain or improve cognitive function. And so it is, again, mild cognitive impairment, Alzheimer's and related dementias, but again, it needs to be early on. And by the way, because these aren't removing plaque, they're not just for Alzheimer's disease. So if you have the earliest signs of Lewy body dementia or frontotemporal dementia, there is indication that these could help with that as well. They also have a lot of stroke patients who are using these. And I love that it also helps with the brain fog. I have had many friends who endure the brain fog from chemo. And boy, it's nice to know that there's something that can help with that. So we've looked at drugs that treat the symptoms and maybe help with progression. We've looked at drugs that absolutely help with progression, but are pretty invasive. We've looked at these new technologies that are about actually working with the brain to reduce symptoms and slow progression. Lifestyle change, especially, and this again, early on, it's less effective, although I know people who are 2 or 3 years into their symptoms and they still feel benefit from making some of these lifestyle changes. So sleeping for 7 or 8 hours a night, this sleep is torture for me. I'm doing so much work to try and have my sleep be better, because I know how important it is. Exercise is critical. And as dementia progresses, it is really hard to get a person, for a lot of people, it's hard to get them to exercise. And so we never ever want to fight or have battles. If a person is willing, it's great for them if they can do exercise. For ourselves, like at the bottom, remember these also help prevent dementia. So 40% of people who are walking around the world right now with dementia are believed to have have not had dementia if they had made lifestyle changes. So 40% of dementias are preventive. Sorry, I didn't sleep well last night and it's affecting my conversation. So anyway, exercise. We should all be exercising 150 minutes a week. And if you break it up by day, that's not that much per day. And what do I mean by moderate exercise? A neuropsychologist friend who I had a conversation with about this said, if you are able to walk and have a conversation, that is not what we're looking for. What we're looking for is you're able to walk and not be able to sing. So you're walking fast enough that singing is a little bit hard, right? That's the level of exercise that we want to be doing. And I don't know if any of you have been reading about interval walking, but that's supposed to be especially helpful. And I've been trying to put that into my routine. And that is that I walk for half an hour and I set my timer for 3 minutes and I walk as fast as I can for 3 minutes. And then after 3 minutes, I reset my timer and I walk at a very normal pace. And then after 3 minutes, I go back to fast, and you alternate back and forth between fast walking and slow walking. And it is better for your brain than just walking fast for 30 minutes. Diet. The mind diet is still what is being touted as the best thing that you can do for your brain. And the mind diet is based on the Mediterranean diet. And it is a combination of the Mediterranean diet and the DASH diet. And the DASH diet is specifically about heart health. But anyway, so that's the mind diet. And it's the stuff that I'm sure you all are aware of. Mostly plant-based, moderate amounts of dairy, very, very, very little meat. If you are going to eat meat, chicken instead of beef, staying away from sugar, right? It's all of those sort of healthy things that help our bodies be better. It's the same kind of diet that we would eat if we want to reduce the chances of getting diabetes or cancer. Social engagement, key, key. And I know that for people who are living with dementia, start being less interested in social engagement. And a lot of that has to do with the fact that they've lost confidence about, like, people think I'm stupid. People seem to turn away from me when I talk. So if we can find memory cafes, if we can find memory dementia-friendly activities, places where we are welcome, where a person with dementia can participate in a conversation. Support groups are amazing. And while we have support groups for people who are caregivers, there are also support groups for people who are living with dementia. And I highly recommend looking into those. Adult day programs, good ones, really help with social engagement. And I know that an increasing number of senior centers, although ours is now called the Center for Creative Aging, that many more of them are dementia respectful and that they have programming that welcomes people who are experiencing cognitive change. Building neurons through novelty and through, hang on a second. Oops, let me go back one. So building neurons through novelty and education. So the things that are tossed out are like learn a language, learn to play a musical instrument. You can do those things, but you could also take an online class. You could do go visit a museum that you have not visited in some time. And um, for novelty, just doing something that you don't usually do, whatever that might be. Oh my gosh, there's a drum circle going on. I'm not a drum circle goer, but I'm going to go do a drum circle because the experience is going to build neurons in my brain. And we want to just keep building neurons as much as we can. And for people with dementia, even though they are losing neurons to the disease, it doesn't mean that they can't still grow neurons. And one of the best ways to do that is through having novel experiences and some form of education. If you're going to sit down and watch TV together and the person is still able to watch regular TV, maybe a documentary instead of a sitcom, for instance. Meditation and mindfulness still top everybody's list of the things that we should be incorporating into our lives, whether we are a person who's early on in their disease or we are a person, especially if we are a person who's a caregiver. And even 5 minutes a day has been shown to be monumentally helpful for our brain health. And then brain games, I just put a few of them on there. I have CogniFit on my phone. Um, you don't need to play it that often. You know, if you're standing in line at the grocery store, you can just bang out a couple of games, and they are research backed and they really can help with maintaining our brain health so that we don't wind up developing dementia. But even if somebody's early on in their progression, I would absolutely look at something like Moneta or NewDays.ai, and then have something like this as a supplement, some of those brain games. So what's next? Well, there are going to be new improved drug therapies. So I was listening to a podcast recently with a doctor who was part of the team that helped bring to market the first dementia drug, and I'm totally spacing on the name of it, but it was the precursor to donepezil, and which is Aricept. And what he said is that the drug was so damaging to the liver that they would take regularly look at liver numbers. And when it got to a point where it was like toxic level, they would take the person off the drug, wait for their liver to regain some health, and then they'd put them back on the drug. So it was a horrible drug. But what they felt is that the benefits of the drug outweighed the liver damage. And if you think about like the first HIV drugs that came out, highly toxic, and yet people took them because it was better than dying from AIDS. And so I think that when we look at things like there's a lot like the hesitation around Leqembi because of the fact that it could cause this a brain bleed, I do believe that we are going to see vast improvement over time, as we have with these other types of drugs, where it's going to become less dangerous and more effective. There are new supplements that are being looked at. There was a research report I read from Harvard Health on lithium, where they looked at the brains of people who had died, and they discovered that people who lived in areas that had higher levels of lithium in their drinking water had lower rates of dementia. So how this translates into supplementation remains to be seen. But there's also one of the people I follow on LinkedIn, Dr. Reza Gomi, RezaghomI. I think he's amazing. And he did a piece recently about the excitement around the possibility of lithium as a supplement. So HMB, Rush University did a paper recently about HMB, which is something that bodybuilders use, and the potential that it could maybe also help prevent Alzheimer's disease. Mm. Psychedelic drugs, the Penn Memory Center associated with, anyway, with Penn, right? Have been looking at psychedelic drugs, and I've been reading more and more about the use of psychedelic drugs And the thing that's interesting is they seem to actually like grow um, neuroplasticity. They grow neurons. And could that potentially be something that helps the brain fight back if dementia is starting to happen? Do they possibly work as a preventative? I'm not suggesting that anybody on this call goes out and takes lithium, takes bodybuilding drugs, or, starts tripping, right? But I am just saying that it's very interesting that there's a lot of stuff that's being looked at. Even vaccines. Are there going to be vaccines that prevent people from getting dementia? I believe truly that in just a few years, this conversation that we're having today will be outdated because there are new treatments, new diagnostic tools that are on their way. And so the fact that something like Leqembi is flawed, yes, but the FDA approving that drug opened up the world of possibilities. So there are a lot of people who thought, we have interesting ideas about ways that we could possibly treat dementia, but the FDA doesn't approve that kind of drug. So what's the point? Now there's a point because the FDA has shown that they are willing to bring these kinds of drugs to market. And so I think that there's going to be a lot of exciting things coming down the road. A reminder to always celebrate the good. And I will go ahead and stop my share. And there we are. Hello to the people who popped in after we had started the conversation. And the what I would love to do now is to just spend the rest of the time just kind of talking about what's on your mind. You have questions about what we just talked about, things to share. Maybe you have somebody who's using Leqembi. So I'd love to hear what's on your minds. And you can pop things into the chat too, if that's a better way to communicate. And if we wind up having absolutely nothing to talk about, I'm always happy to give people the gift of time as well. I do want to do a plug for you may know that we also do these superhero support series. And I'm very, very excited about the people who are going to be um, joining us in the next few months. The 1st of October, we have Vicky DeClercq, who is the daughter of Naomi Feil, who is the mother of validation theory. If you don't know validation theory, as a caregiver, you should know validation theory. I can't believe our good fortune that she's willing to come talk about what validation theory is, and then to field questions about specific things that people are doing. And Claudia, thank you for being here today. Anyway, so I'm really excited to have her. Following her, we'll have a guy named Kevin Jameson later at the end of October, and he's going to be talking about wandering and elopement. What do we do about it when people who are supporting have a tendency to leave? And then in November, we're going to be joined by Dr. Carol Heyman. She is a pediatrician whose specialty is dementia care. And she's coming in as a doctor to who works with a lot of dementia patients and their families to just be there as a resource so you can ask questions. I'm going to ask her to first talk about how we can best advocate for ourselves as caregivers when we go to visit the doctor. What should we be bringing? What should we be doing to prepare so that we can get the most out of the visit? But anyway, so those are some things that are coming up. I don't see any questions in the chat. Does anybody have anything that doesn't
I'll
need to
throw
be
one
about
out
Bruce?
there.
What's that, Bruce?
I'll throw one out there.
Please.
Diet. When we, in our care partner groups, um, there's a lot of discussion on ice cream, and the fact that they start to crave sweets, especially in mid to later. And it's a question of how much do I fight this?
Yep. It's a great question. And the word that you use, fight, is something that we absolutely want to avoid as much as possible. Um,
That's
Generally, the recommendation is if you can substitute a less detrimental product, like maybe a frozen yogurt, like a low-fat frozen yogurt, that you could try something like that instead.
yeah,
Smaller portion that you do
that's
instead. You even get like a smaller dish. Maybe you have a smaller spoon, whatever it is, because if you don't offer anything, then you're going to get a fight. Because you
Yeah.
know what? It's their brain talking. Their brain is hungry for sugar.
Yeah.
And so
Well,
they
I tend to make it very small and stretch out the time in between. So
yes.
it's not very often and there's something still coming, but there's some people that's just, you know, he's far enough along, give him what he wants.
You know what? I totally I buy that. I remember when my grandmother was living us with us and she didn't have dementia, but she was very elderly and she just suddenly started eating sticks of butter. And my mother was just like, well, let her eat the butter. She's she's old. Her body is starting to fail, and she gets such joy out of that butter. Here, let me unwrap that for you, right? And so I remember being horrified as a teenager that we were doing this to my grandmother. But on reflection, I realized, you know what? She loved it. It prevented fights, and she wasn't going to live forever. And it probably wasn't going to be the butter that did her in, right? And yeah, Barbara, you have something to add there? Oh wait, you're off microphone, Barb.
I got off when the phone rang.
Yeah.
I'm reminded of something I tell everybody who is a care partner or around somebody living with cognitive impairment, and
Mhm.
that's to go to their reality. And if you think of it, the ice cream and the treats and the things, that's the basis. It's the base thing of their
Yeah,
reality as to what feels good, what they need, what's right. So I think that goes along with going to their reality.
Yeah, I
yeah.
agree with you completely. So Bruce, I guess the answer is both, right?
It's
If yeah, if you can get away with giving a smaller portion, do it. But if the
yeah,
person really pushes back, I'd be inclined to say, okay, let's have ice cream.
yeah. I fortunately have a situation where I don't have any pushback, which is terrific. It's
Yay, you. Yeah.
also we've had two people in the group who have had people with Leqembi. One of them ended up stopping because of brain bleeds,
Yeah.
and the other one was very early. And the caregiver felt that it worked, but they had a huge drop off after.
Yeah.
Yeah, it wasn't scientific, but it's,
Yeah, I'm next October on October 7th. I'm friends with a guy who is the ASI, EISAI, the company that makes it, is somebody who I know. Is this I know their sales rep for this region, and so he and I are getting together on October 7th because he's going to be in town. We get together from time to time and we chat about the findings. And of course, he's like, it's amazing. Why wouldn't anybody do this? Because he's the sales guy. But I do like getting that perspective as well. And then I do check in with doctors about how's your patient load? What are you finding? And the biggest issue that they're running into right now, some of the people who I know, is this problem with proximity to sites where they can get infusions. But I think it's really cool that you personally know two people who are doing it
well,
and you
actually,
get to
we have
watch.
one more that was refused because they have brain bleeds already.
Yeah, yeah. That makes perfect sense. I
Yeah,
honestly I don't know what I would do. I'd
I,
have to like cross that bridge when I get there. I'm hopeful that if a time comes when I need to make a choice like that for myself, that there are even more options.
yeah, I was kind of a little bit past the timeline for that kind of, and I was
Mhm.
like, what's the quality of life and what's going on here? And let's do what we can do. And
Yeah, I agree with you completely. Yeah. And thank you for asking those questions. Anything else? Just anything that's on your mind that you would like a little clarity around, or we're a smart group here. We can help each other. All right. Well, I won't make you guys stay on a call. I'm grateful to you for having visited today. And was it helpful?
Yes, very much
Okay.
so.
Okay, good. Would you like me to email you the slides?
Yeah, that would be great.
Yes,
Okay.
please.
I'll go ahead and do that. And let me just take a quick, I'm just going to capture this so I have all of us on it. There we go. Okay. All right. Then I will say, have a great rest of the day.
You too.
We'll talk again soon. I
too.
really appreciate you being here.
Thank you.
Thank you.
Bye-bye.
Bye.